All right. So next we're moving to our highlighted keynote speaker. His name is Ethan Smith. You may know him as the International OCD Foundation advocate. I first saw him in 2014 when he gave a keynote speech at that conference, and I was just in awe and just have really been a huge fan of his ever since. He is a multi-talented person in terms of his advocacy. I recently were working on a project on optimizing like Y-box training, and it was amazing to see him behind the camera and directing and producing. And he is another person who's so special in the sense of seeing like passion, purpose, and talent all together in one package. It's really cool to see people who are in that zone. And it's just a delight to have you here today with us, Ethan.
Oh my gosh, thank you so much for that, Carolyn. It's so sweet. And I feel exactly the same way about you. Also, shout out to Kira. That was an awesome presentation. I'm so glad I got to see it. It was so accessible and fun. And you're a great speaker. So I agree with Carolyn. That was awesome. Thank you all for having me. I'm super excited to be here. Also, I just finished speaking and I moved a shirt to that desk. It's making me very uncomfortable because I had the background perfect and I just noticed it. I desperately want to move the shirt, but you know what? I'm just going to sit with the discomfort of the shirt being there and
That's awesome.
and let you know. So I'm just going to embrace that fact, and Kira can be super excited about that. And thank you, Deirdre, for the kind comment. All right, so we've got 20 minutes to talk. We have a 10-minute Q&A. I will keep this short or long, just depending, probably long. I'm going to tell a little bit about my story. If you haven't heard it, please feel free to comment in the chat if you're like, yeah, we've heard this, move on. But I happened to pop in on Dr. Karan's the end of it, and like I'm on all his medication. So this is great because I can kind of touch on some of the things and maybe piggyback on what they were talking about as well. Hey, Valerie Andrews, good to see you. Okay, so some quick me stuff. Was born with OCD as far as I could tell. Genetic predisposition at least. And as soon as I could form words, I was worrying and complaining. So it's reasonable to assume that that wasn't just because of my Jewish heritage. My earliest memories were, I was afraid of swallowing a fly in kindergarten because I was afraid my head was going to explode. I was afraid of my mom staring at the sun during an eclipse because she would go blind. So I was very adamant about staying with her to make sure she didn't go blind. Later on, my OCD morphed to caring more about myself than other people. And that's great. I really don't care about anyone else now. I just care about myself, and that's okay. That's good. I'll embrace that too. As I got older, and by 6 or 7, my OCD symptomatology really took on, I guess, what you would call more mainstream OCD, which I don't even like to use that word, and it shifted since I first started talking about this, but checking, counting, symmetry. I had really bad emetophobia, and I would spend hours and hours at 6 and 7 years old performing compulsions to try to prevent myself from throwing up. As I it into junior high and high school, it shifted into health anxiety. At that time, back in the olden days, it was hypochondriasis, but it was health anxiety. Brain headache was a brain tumor. Fever was meningitis. I carried 3 thermometers around with me. They were incidentally named Larry, Moe, and Curly. That is true story. And I took my temperature upwards of 100 times a day. I knew what my temperature should be at every moment of every day. And if it was off of that, I desperately wanted to make sure that I wasn't sick. So I would do things like throw water on my face to cool my body, and in essence, school was really hard. At age 14, I was diagnosed with OCD. And this was a good thing and a not so good thing. I think for me, I didn't really have an aha moment with the diagnosis. And I know this is very different for lots of people. A lot of people are so great to finally have a name for what they've been going through. I think this was partly because, my parents were so accommodating, not knowing that was hurting my OCD or hurting me and helping my OCD. The other part of it is I always looked at it as, I guess I'm just different. I don't like to spend the night out with friends. That's super scary. Or going to sleepaway camp because that's super scary. Or, doing anything fun because that's super scary. And so, getting that diagnosis just kind of confirmed to me that I maybe wasn't similar to most of the other people that I saw, but I also wasn't an aha moment for me either. What it did do was set up a course of treatment for me that was all wrong. So yay. So Harvard study 99, from diagnosis to treatment, average time 17 years to find the correct treatment, I should say. For those of you that haven't heard that, that's like going to the doctor for a foot problem and then taking 17 years to find a podiatrist, which seems absolutely insane. It was exactly for me 17 years, incidentally, from the time to diagnosis to the time to finding the proper treatment, exposure response prevention. But up until that point, and by the way, that number has decreased to around 10 to 14 years. And I don't want to joke and say we're making progress. We are making progress, and that's an amazing thing. Still way too long, but we are making an effort and chipping away at the access to treatment, even just knowing what the treatment is. I personally think I was a product of when I was born, in the late 70s, early 80s, where, Grayson and Edna were just like, ERP could be interesting. So by the time I hit high school in the 90s, that really wasn't, we didn't have Google and that wasn't a thing. So, I missed out. As I got older, OCD really created a box for me in which I had to navigate in. It was a very small box, and the box got smaller and smaller as I got sicker and sicker. Dropped out of college after 3 months. I was acting at the time, went to a really prestigious acting conservatory, thought I had a brain tumor in October, was having the time of my life, and dropped out and couldn't go back because I was just a disaster about it. My mom actually came up to college and stayed in a hotel for a month with me just so I finished the semester, because I was afraid to be away from her. Also had severe separation anxiety. And throughout my 20s, OCD played a prominent role in really keeping me back and holding my life back as I became more successful in my acting career, eventually starring in TV shows and films and, supporting myself as an actor. It drew me out to Los Angeles, but I was unable to go because of my OCD. And people would constantly ask me, well, why are you out there? You could be doing A, B, and C. And I was like, I don't know. I'm afraid to be away from my mother. And what if I die and I'm going to be sick? And, so navigating, I'd go through these periods of time where I was highly functional, still very sick, but highly functional. And then just crash because I had spent the last 3 months white knuckling or just gritting my teeth through it and couldn't do it anymore. Incidentally, I defined health and wellness as function and not function. Not even joy, not even peace, not even happiness and anger. Forget the emotions. It was, if I was functioning, then I was healthy, even though I was extremely sick and still obsessing and compulsing. And if I was not functioning, then, well, the OCD had taken over. And that's how I defined it in my life. Psychodynamic talk therapy, 10 different therapists. Toward the end, right before I got really ill in my early 30s, when I was about 30, 31, I was so desperate to get help. I went to hypnotherapists. I went to past life regression therapy. I went to energy healers. I probably would have sacrificed a goat. At that point, I was just so desperate to get help that, and that's what's scary is like you see that stuff on Instagram from, for lack of a better word, no offense, charlatans of like saying, hey, celery juice cures OCD. I probably would have done that because I just wanted relief. The OCD got so bad that I was eventually bedridden, living in my parents' guest bedroom. I was unable to eat and drink because I was afraid that I was going to accidentally poison myself. My OCD shifted at another point from health anxiety to self-harm around what if I accidentally kill myself? What if I accidentally swallow pills impulsively? This all came incidentally from a diagnostic to determine if my depression, if I was suicidal. And the doctor asked, do you have impulsive tendencies? And I said, no. He's like, you sure you wouldn't accidentally just swallow a bottle of pills randomly as you take your pills? And I was like, no, that's ridiculous. And then I got in the car and went, my God, what if I swallow a bottle of pills impulsively? And on that day, this is the amazing thing about OCD. 15 years I took my temperature, 15 years. And every doctor, whether they were all wrong, still tried to get me to say, you got to stop. From the minute I had that thought, stop taking my temperature. Fever was irrelevant. I was going to die. Who cares about fever now? And so that, I think that's just so amazing from a clinical standpoint that it just can shift like that. And something that I was unable to stop just with a thought. That self-harm grew into everything from household cleaners to a specific fear of hitting my head and afraid I was going to have a brain bleed. Hit my head with my hands. I actually became afraid of my hands. I would tie my hands up in the elastic of my underwear so I would restrain myself, which is completely illogical because clearly I could unrestrain myself and hit my head. But to Kira's point, you can't attack OCD with logic. And so, because it is an illogical disorder. I ended up in a psychiatric hospital after getting 5 CAT scans in 1 week because I was afraid I had a brain bleed every day from hitting myself. That's not a healthy thing. That was my hand washing. I do glow in the dark now. It's a fun party trick, probably not the healthiest thing, but regardless, that's what I did. At the psychiatric hospital, they diagnosed me as psychotic because my overvalued ideation was so high, and treated me as such. You know, that was a shame because I have a lot of PTSD from those 3 weeks, being treated as a psychotic patient that was constantly dysregulated. It was always OCD. There was always that part of my brain that knew it was illogical, but I was so unwilling to live with the discomfort, so unwilling to live with the uncertainty around what if. And this is my fault, and this is part of where we need to rely on experts to identify OCD, is because at my time I was sick, I had no insight, I had no objectivity, I had no education. So I would phrase it as, oh my God, I'm going to go back to my room and I'm going to accidentally hurt myself. What I meant to say was, what if I do this? I don't want to. My value, this is ego dystonic to my values, but I don't talk like that. I don't even know what OCD barely is. And so when a doctor hears me say, I'm going to go back to my room and hurt myself, he's going to be like, or I believe I hit my head in my sleep and I have a brain bleed and I need to go to the hospital. What I really meant was, I think I did. I'm not sure. I can't remember. I can't live with the uncertainty that I might have. I need to get checked out. So he hears that, and he doesn't hear the doubt in my voice. And so he goes, okay, well, there's psychosis here, delusion. And, but I don't feel like I should be responsible at that stage for properly, eloquating is not a word, but expressing how how I'm experiencing my own OCD. Shortly after I finally found ERP treatment, it was 20 minutes away from my house for 14 years and didn't know it. And engaged in it. It was really hard. I went without hope, and not having hope and engaging in ERP. They said the same thing all the other therapists said to me, which is, we can help you. And I was like, after all of that, I was like, no, you can't. Nobody can help me. I'm completely broken and this is going to kill me. I did intensive outpatient for 10 months. And I got slightly better. I really desperately wanted to get better, could not make the shift into embracing and doing ERP. I could write a treatment plan for all of their patients at this clinic, but I couldn't do it myself. And when I say couldn't, I wouldn't do it myself. I wasn't willing to do it myself. At the time, I didn't realize it was a choice, but I was unwilling to take the chance. Ended up at OCDI in McLean Hospital at Harvard, spent 2.5 months there, eventually got kicked out for faking an accident, cutting my head open and diving in a snowbank, to have someone find me unconscious, call 911 and get to a hospital to give me a CAT scan. To make sure that I didn't hit my head. The reason for that was I'd written a contract with my doctors and my parents saying, if I went to a hospital, I'd be disowned and I couldn't have any more therapy. So I was thinking, well, maybe, I can't go to a hospital, but a hospital could come to me. Oh, how creative we are if we could use our powers for good and not evil. So I did. I faked an accident, got to the hospital. They gave me a CAT scan, and I went back to McLean like nothing had happened. Like, this is probably highly illegal, but whatever. So 2 weeks after that, they kicked me out because I had come clean about what had happened. And this was the greatest thing that could have ever happened to me. I always preface this part of the story by saying, and I am timing myself, so I've got 8 minutes before Q&A. I always preface this part of the story by saying, if you hear this part and you or someone you're suffering, or love, or child is suffering, this is not the go-to stage of treatment for OCD. You don't want to, what I'm about to tell you, don't be like, oh, I should do this with my 8-year-old. When I first told this story, parents were coming up to me and asking me if they should do this. I'm like, no, don't do that. So in essence, I was kicked out of the OCDI. My parents cut me off, at least as I saw it, because I had this severe separation anxiety. I was told I couldn't go back home or I'd get arrested. They sold everything that I owned and said I had to start a new life in Boston, which was terrifying to me because emotionally I was 8 years old. Moved into a house with $400. It was a terrifying house. It was in a not so nice part of town. And I shut myself in my room for about 6 days, and laid there in bed, went to the bathroom in bed, didn't move, and contemplated whether I even wanted to live or die. On that 6th day, I realized that nobody was coming for me, that I wasn't going to get help, that nobody could save me, that I hadn't eaten, that I'd really gone to get water. Nobody was there. And it was like, oh, wait a second. I have to make a really important choice here because it's up to me to save myself. And so what the doctors had so brilliantly done, and I was working with some amazing doctors, and I was really blessed. Dr. Janicki was on my team, and the guys at OCDI and NBI and Florida, but they had put me in a position where life became more important than OCD. I had to choose life or I would literally die. And so I eventually decided to walk through the fire and do that. That 8-month process, was difficult and hard. I did not do ERP therapy. I started back with a therapist at the OCDI, and all we did was ACT. That's all we did. We did ACT 3 days a week, and then I would meet with my old ERP therapist in McLean, and he just helped me with navigating life. The ERP was happening involuntarily because that's what I had trained. I was put in a position where I was forced to use it, right? ACT, to Kira's point, was completely game changing for me. And if you'd heard my speech in 2014, I say that ERP didn't work. ACT is what saved my life. My amendment to that is ERP absolutely worked. I just didn't know how to embrace it. And ACT really helped me embrace ERP, at which point I was able to use ERP to get better and stay better for the last 11 years. Not saying I have perfect days. You'll hear me as I talk about that. There's good days, bad days. I always say more good days than bad, and you're winning. You can put that in any form of measurement you want: minutes, seconds, days, years, but more than less, that's a good thing. Short-term pain, long-term gain, right? So for me, ACT changed my relationship with my thoughts. ACT really honed in on my values, and it made it very specific. The things I was choosing, when I wasn't choosing OCD, it was for a very specific reason. To Kira's point, she had that, that list of values. And so for me, it wasn't so much, oh, I need to fight my OCD, which I didn't understand that, because that was an ambiguous sort of vague theory to me. Fight your OCD. What does that mean? I don't even really understand what OCD is. But when somebody said, when you choose to compulse, you're choosing to never be with a woman. You're choosing to never audition for a part. You're choosing not to fill in the freaking gap of what you love to do. So when I can suddenly say, okay, in this moment, once you have therapy, you get that distance, that diffusion happens between your thoughts and an ability to maneuver. And you can literally say to yourself, I have a choice here. I can choose OCD, or I can choose a value, but it's more specific than that. Not a value. What? God, I need to work today. I need to make money so I can live. So I can choose OCD, or I can choose not to work. And that's just a stepping stone. Work is a goal, but the value is success. What is success? It could be a variety of things. Once I specified what this looked for me, making those decisions became easier, because it wasn't just, I got to fight my OCD. It was choose OCD or choose a goal and a value. And those two things are mutually exclusive. You can't choose OCD and choose your values. It just doesn't work that way. Also, to Dr. Karan's point, when I signed on toward the end of his, I'm on all of those medications, like I said before. No, and all jokingness aside, I was actually put on Mantine at Harvard and McLean by Dr. Mike Janicki, in 2010. And incidentally enough, it was one of the first. I've been on every SSRI. I don't typically talk about medications because I'm not a psychiatrist. I'm also not a clinician, so I'm not sure why I talk about OCD. Regardless, that was one of the first medications that I had noticed a difference in my OCD, where I went, that's slowing down my racing thoughts. That's very interesting. So glutamate modulators, very cool. You're okay. Just want to let you know it was up until leave me a few questions. Okay, cool. So thank you, Carolyn. Yeah, 10:05. Okay, yeah, I have 5 more minutes. Perfect. Then we go to Q&A. So eventually I got better, and my exponential growth just happened. I experienced joy for the first time. I experienced serenity for the first time. I was dating and having meaningful relationships. I rebuilt a relationship with my parents that was healthy, and eventually went home for 2 weeks and then moved out to Los Angeles, and the rest is history. By the way, the history is OCD did not define my functionality. Doesn't mean that it wasn't there. Doesn't mean that I didn't compulse or still don't compulse. It means that 99.9% of the times my choices are based on Ethan, not based on OCD. It also doesn't mean that life has been perfect. Life is freaking hard. And I thought that after I got better from OCD, life would be easy because OCD wouldn't be in the way. That's not exactly how it works. Life was super tough, especially because I hadn't known life before OCD. So suddenly I didn't have OCD to blame. So when I didn't succeed at something, holy crap, the secondary gain of OCD was gone. Now it was Ethan. Ethan isn't talented enough. Ethan isn't smart enough. Ethan failed at this thing that I thought I could get. So I was grateful to participate in life, but it was really, really hard, and still is really hard because life is hard. The cool thing about it, though, is there was always in the bottom of my heart this appreciation for what I was experiencing. And the reason for that is when you're on the sidelines of life, watching life happen, that's a crappy place to be. So as miserable as life, the curveballs that life can throw you, whether they're tragedies and milestones or just things in your job or just a bad day, right? There was always this sense of gratitude, and still is deep down, for experiencing these things, because I was experiencing these things, good or bad, joy or pain, sorrow or excitement, or even serenity, which is something I never thought I would feel in a million years. Those are all a result of living life. And I never take that for granted, and I hope to never take it for granted. So as good or as bad as my life is, I can always say, yeah, it's because it's this way, because you're living it. And so I can have a lot of gratitude, and I can make a lot of room and space for those emotions and feelings. And I can navigate and operate my life within those emotions and feelings. Gosh, we want to feel good, do stuff. Like, I want to do it and I want to feel good. But guess what? Feelings, especially with an OCD, are kind of irrelevant. Not saying they're not valid. Your feelings are very, very valid. But in terms of getting better, in terms of action, in terms of opposite action, in terms of heading toward your values, how you feel, that is not a determinant on whether you should or shouldn't do something. That is definitely not a determinant on if you're getting better or worse. If you gauge your improvement by feelings, you're going to let yourself down. Your improvement is based on your actions. And so that was a great lesson for me, is that I could have a magnificent day and feel terrible. And that what a great paradigm shift. We're at 20 minutes right now.